We offer with Denplan 2 different plans, or 3 actually, because we've got kids as well. For patients that don't have high needs in terms of, where they don't have decay a lot and that sort of thing, where it's maintenance, they came up with what's called the Essentials plan. So it's effectively however many visits per year that are necessary, checkups, usually 2 checkups a year with the dentist, any screening x-rays as well, which is normally a couple of x-rays every couple of years, and then hygienist appointments as well, so in between times. So those patients will come in usually 4 times a year. Sometimes they'll have a checkup and the hygienist at the same time because they prefer that. And the idea is it's priced to basically cover those things. It includes some insurance as well, so weekend emergencies, out of hours, bank holidays, that sort of thing. And care overseas, if someone's had some emergency treatment in the States, whatever, they get reimbursed for that. And that is priced to be cheaper than if you pay each time you come in. So the idea is it's an incentive for the patient to kind of buy into the regular maintenance ethos. And invariably those patients do come in more regularly, so it's kind of a self-fulfilling prophecy. So then there's the full care, which is based more on a risk profile, which then covers all day-to-day treatment. That can obviously vary in cost depending on the patient. There's 5 bands of cost per month, and then patients fall into that depending on what points they get. It's like each filling is a certain number of points, and gum health and so on is taken into account. That's a bit more complicated to work out and isn't for everybody. So yeah, it's always discussed on an individual basis really. And children's, it's a much more simplistic view. There's basically for children, it's a monthly cost, and it's just very simply based on a kind of risk profile. So generally if someone's, for example, having orthodontics, the recommendations are to see them every 3 months for a routine checkup, and for fluoride application, cleaning and oral hygiene and that sort of thing. So they would go in a slightly higher band to say someone who's not having orthodontics and is only coming in every 6 months. And for very young children, we just offer, we tend to see them free of charge effectively when they come in with their parents, because it's not a lot to do when they're 2 or 3 years old. It's just getting them into the habit. Usually jump in the chair, have a quick look, have a sticker, come back next time. And then they're in the routine of doing it by the time it becomes a bit more serious, when their permanent teeth come through.